Well, let's talk about Beryl, Michael. She's an 82-year-old lady, and apart from rheumatoid arthritis, for which she was taking ibuprofen, she also had a heart condition called atrial fibrillation. It's an irregular heart condition, and we treat this with blood thinners to make sure people don't have strokes. So she ended up on 2 medications which potentially can affect her stomach and put her at risk of bleeds from her stomach, which exactly that's what happened to poor Beryl.
Yeah, I mean, I come across patients like Beryl all the time, but I mean, what was the reason for her being on the ibuprofen?
Rheumatoid arthritis. She was on some other medications for her rheumatoid, but the pain was immense. She was on a number of other painkillers, and she felt that over the years, these non-steroidal anti-inflammatory medications, which ibuprofen or Nurofen, other likes of these medications, were helping her the most, which is not unusual. These medicines are indeed very good for arthritis of various types, whether it's osteoarthritis or rheumatoid arthritis, gout, pseudogout, many types of arthritis.
Yeah, I mean, this is the reason why we have a box here. So we would take ibuprofen here, and that's because we're young. Our stomach linings are better than our elderly population, and also we tend to find that we get less problems with using these.
Also, we don't have to use them quite often, quite as often as Beryl was using. Other uses of ibuprofen, of these non-steroidal drugs, are high temperature, aches and pains, headaches. There are many indications. These are very good painkillers and general anti-inflammatories.
Yeah.
But the short use in younger patients, of course, will have much fewer side effects than a regular use in an older person who is taking it for a chronic medical condition.
I mean, going back actually to Beryl being on a blood thinning drug we call an anticoagulant, it will increase your risk of bleeding by at least 1.5 times, if not twice, the incidence of bleeding. So it's not something that we should think is a minimal concern. This is a major problem we're finding, and it wouldn't surprise me that Beryl had major problems from
She
using the
did.
two.
She was admitted. She had a camera test. The camera test did find quite a big ulcer in her stomach, so she needed blood transfusions and so on. But talking about these anti-inflammatory medications, non-steroidals, it is important to remember the other side effects as well. Apart from irritating the lining of the stomach and causing gastritis, stomach ulcers, these medications also can upset your kidneys, so cause kidney failure, acute kidney injury. It is absolutely crucial that you have, if you are on these type of medicines long term, that you keep an eye on your kidney through regular blood tests. You challenge your GP, your general practitioner, and get those blood tests done on a regular basis.
And there's also the common side effect we come across, which is actually fluid retention. So you retain fluid with these drugs, which is in many ways linked to its effect on the kidneys. So looking at the population of patients I would treat, patients with heart failure, being on an anti-inflammatory like ibuprofen, naproxen, these individuals are more likely to retain fluid and necessitate higher doses of other medicines. It goes back to the cascade issue we had talking about in one of our previous posts.
Absolutely. If you are someone with a heart condition of any sort, whether it's a diagnosed heart failure or even angina condition, these medications, by retaining fluid in your body, will exacerbate that heart condition. You might have more angina, you might experience more fluid retention, and then you will need more water medicines. And if you have more water medicines, you damage your kidneys more, and it goes round the cycle.
Some patients who have severe forms of asthma can become extremely tight-chested, what we call bronchoconstriction, with the use of non-steroidal anti-inflammatories like ibuprofen. So it's not that they can't take them; it's because some individuals are very sensitive to the drug. So it depends very much on a patient-by-patient basis.
What about COPD patients or smoker or patients who have so-called smoker's lung condition?
The same thing. Some individuals have what we call a predisposition to actually have constriction, but also in the individuals we're talking about, they're more likely to be on steroid therapy, which then we have issues with the kidneys. So it's all about multitude of medicines that can affect the kidneys. And we're going to come on to the likes of the the thing of sick day rules as well. Patients who are on these medication and they become unwell, nausea, vomiting, diarrhea, the likelihood of you actually having kidney problems is increased dramatically while you're unwell. So being off these medicines is essential during periods of ill health.
What I'd say for my elderly population is being off these medicines altogether is a very good idea. It is very poorly tolerated because as we get into our late 70s, 80s, inevitably we do develop many other medical conditions, whether it's a heart condition, pre-existing kidney injury. If you had diabetes, your kidneys will be affected. And this type of drugs, of course, will be quite detrimental. As a geriatrician, I'd say avoid them altogether. There are many other painkillers, many other ways of managing various pains, arthritis. So see your doctor, consider your options. But if it's possible at all, avoid non-steroidal anti-inflammatories, especially if you are someone with pre-existing kidney problem or stomach problem or heart problem.
My top tip completely echoes you, Eleanor, in terms of what you're saying. Only use the medicine if you need to. Use it for the shortest period of time that you can get away with, especially if you're using it for aches and pains, and also use the smallest dose you possibly can. I see too many people going straight for the 400 milligrams of ibuprofen when the 200 will equally be better. You get less problems from this. So I hope this was beneficial to you. Any questions that you have, anything you want us to cover in our next post, by all means, leave a comment and
click that subscribe button for us.
Keep well. Bye-bye.
Thank you.